The Flat Earth Society is chomping at the bit to bring back masks, even though the Cochrane analysis has looked at 78 randomized controlled studies and shown that masks didn't stop transmission, didn't stop hospitalization, and didn't lessen deaths. In other words, the masks on a population level had no influence over the spread of COVID. And yet the Flat Earth Society cannot listen and absorb these facts. They want the masks to come back. In addition, the Flat Earth Society also wants to mandate 3 COVID vaccines for kids, despite no evidence that COVID vaccines reduce transmission, hospitalization, or death for adolescents. And yet, to this very day, Senate pages are required to get 3 vaccines in order to participate in the program. I rise today out of a desire to protect the health of the young men and women who serve as Senate pages. I think we can all agree that the Senate wouldn't function very well without the pages. The very first page was a 9-year-old boy named Grafton Hansen. He was appointed by Daniel Webster back in 1829. In those days, the pages had to refill the inkwells and clean out the spittoons. Things have changed a little bit around here since then. The work isn't quite as messy anymore, but it's still a high-pressure job for a high school student. From day one, our country's response to the pandemic made the comfortable more comfortable, while the working class had to keep on working. And now in the halls of Congress, a privileged class can choose whether to get vaccinated, while an underclass must abide by COVID dictates. Think about it. The antiquarians of the Senate are not required to be vaccinated, but the young, healthy people at 0 risk for death from COVID are being forced to be vaccinated 3 times. To become a Senate page, you must get a COVID-19 booster shot. But study after study demonstrates that for young and healthy people, the risks posed by the vaccine are greater than the risk from COVID. And let me be clear about that. This is for young, healthy adolescents. The facts are different. If you're elderly or infirm or have other risk factors, the risks of the disease outweigh the risks of the vaccine. But for young, healthy people, none of them will die from COVID. Almost all of them have either had a vaccine or had the disease or both, but we are mandating that they have 3 vaccines. Study after study shows that it makes no sense to mandate COVID vaccinations for teenagers who are healthy, and that such a mandate actually may be dangerous to adolescents. A study published last year in the Journal of American Medical Association Cardiology examined 23 million people ages 12 and up across Denmark, Finland, Norway, and Sweden. It found that after 2 doses of mRNA vaccine, the risk of myocarditis was higher within 28 days of vaccination. So they had a risk of developing a heart inflammation within 28 days of the vaccination compared with a group that was unvaccinated, and that the risk increased with each successive dose. So there's a risk, particularly for the ages between 16 and 24, of an inflammation of the heart, and it increases with each successive dose. So if you are going to mandate 3 vaccines on a group of kids who have 0 risk of dying, and the vaccine doesn't prevent transmission, protects no one, all you are doing is adding a risk to their health. And for goodness sakes, in a free country, couldn't we let them make their own medical decisions? This is exactly why European countries, including Germany, France, Finland, Sweden, Denmark, and Norway, restrict the use of mRNA vaccines for COVID. There are rules for young people. Yet the policy for the Senate pages blindly commands 3 vaccines for young, healthy people. A study published in December in the Journal of Medical Ethics found that per million 3rd doses, booster doses of COVID vaccine, up to 147 cases of myocarditis may be caused in males ages 18 to 29. Up to 80% of those diagnosed with vaccine-induced myocarditis or pericarditis continue to struggle with cardiac inflammation more than 3 months after receiving a second dose. And yet, remember, this is a group of people who have 0 deaths. 0 deaths. There are no deaths from young, healthy people from COVID, and we are mandating that they take 3 vaccines. We're supposed to be the leaders in this country. What science are we looking at? What science are we obeying? We are reacting in an emotional way. We are promoting hysteria and leading with the wrong example. Recently, Dr. Vinay Prasad and Dr. Benjamin Knudsen published a review in the European Journal of Clinical Investigation that examined 29 studies across 3 continents. 6 of the 29 studies showed that after 2 doses of mRNA vaccine, more than 1 in 10,000 males between the ages of 12 and 24 would experience myocarditis. Think about it. To be a page up here, you send a perfectly healthy young man or woman up here, and then you give them the risk of a serious heart inflammation over a disease that is evolving every 3 or 4 months, such that the vaccine's good for about 3 or 4 months till it's no longer good for a disease that was never deadly for children. Initially, the argument was, oh, we got to stop the children from transmitting it to the old people. It doesn't work that way. The only thing even the proponents of the vaccine argue is that the individual vaccinated may have a reduction of hospitalization and death. But those statistics only hold for at-risk populations. The elderly, the immunocompromised, the ill. For young, healthy people, there is no health advantage to being vaccinated, and there's actually a health disadvantage the more vaccines you give them. It is actually medical malpractice to continue to mandate 3 vaccines, whether it's in the Senate or in a university. And unfortunately, the example that's being set here in the Senate is being followed in other universities around the country of mandating 3 vaccines. A study published recently in the Annals of Internal Medicine found that regardless of sex, among those ages 5 to 39, myocarditis or pericarditis occurred in 1 in every 50,000 after a first booster. With statistics like that, why would we think it's a good idea to insist on boosters for our young, healthy pages who are in their early teenage years? We're taking the rights of the individual, their parents, and their physicians to make a decision based on their risk factors and their individual parameters, and we are making a blanket rule that says they need to get vaccinated. And yet, study after study is showing that the risks of the vaccine exceed the risks of the disease for this particular age group. It is the height of malpractice to subject young people to the greater risk of vaccination simply to satisfy mandates designed to protect bureaucrats from accountability. Now, I am told that the Democrats will object to this today. The Democrats will stand up and say they know better than your parents. The Democrats will stand up and say they know better than these kids' doctors, and that, by golly, you want to be on the Senate floor, you have to have 3 vaccines. Well, guess what? I've got 0. I'm standing right here. I've got 0 vaccines. I had COVID in the first month of the disease, and actually I likely would have gotten vaccinated, but I got the disease early on, and then all the evidence pointed towards immunity being gained from having the disease, so I didn't bother getting the vaccine. Members of my family got the vaccine. We recommended that my elderly in-laws get the vaccine. But the thing is we made that choice. And so here I sit without a vaccine, and I won't wear a mask because they don't work either, and yet then we're telling them, in a month, are we going to be putting them back in masks? The Democrats want everybody in masks. They want the hysteria to return. Why? Because they don't think any of us are smart enough to make our own decisions. They want to make the decision for us. The common man be damned, the working class be damned, Americans be damned. The Democrats are going to tell you to wear a mask, and the Democrats are going to tell you how many vaccines to get. Well, the vaccine goes out of style. The virus evolves away from the vaccine within a couple of months. How many mandates are there going to be? Why not 6 mandates? Why not 12? Why not mandate the newest booster that may have more effect than the last booster? Which one are we mandating? They just have to get 3 vaccines. but it goes against the science. And let's say you even grant the Democrats that there might be some scientists on the other side of it. Good. Let the individual make the decision. Whatever happened to the idea of individual choice? Whatever happened to the idea of choice with regard to your body and your medical decisions? The hypocrisy is astounding. Recently, doctors Vinay Prasad and Tracy Beth Hogue and Ram Durasetti shed light on some of the science surrounding this, on some of the efforts to manufacture studies that artificially bolster the case for mandates. In a letter published this July in the New England Journal of Medicine, Dr. Prasad and his team question an Israeli study that the FDA and our government, Democrats, are trying to use to justify forcing people to take boosters. This study, they said, shows a 90% reduction in death if you take the COVID booster vaccine. And they kind of scratched their heads and they said, well, almost nobody's dying anymore because the virus has become less dangerous as it's evolved. More people have immunity, either natural or vaccine immunity. To have a 90% reduction in a death rate that is already very tiny just seemed a little bit unbelievable. So they looked at the data from the study, and what they found was that actually there was a 90% reduction in the booster category for all diseases, cancer, a variety of, diabetic, heart attacks, you name it. People died 90% less of the time if you were boosted. It's like, wow, booster cures heart disease, cures diabetes, it cures cancer. No, it turned out the study was flawed, and the group that had been boosted died 90% less of the time just because you got to select it out for a group that was very healthy versus a group that was less healthy. The study was flawed. And it took scientists with the courage to stand up to the New England Journal and say, look at the data. The original authors of the data finally released it and said, whoops, we made a big mistake here. Our study doesn't really prove what we said it proved. When the FDA approved boosters for kids, did they show that it reduced transmission? No. When they approved vaccines for adolescents, did they show that it reduced hospitalization? No. Did they show that it reduced deaths? No, because no kids are dying from COVID. You can't be less than 0 deaths. How did they approve the vaccine at all for adolescents? How did they approve the booster? They said if we give them a booster, they make antibodies. Well, I confronted Anthony Fauci of this and I said, well, I can give you 100 vaccines. Every individual I give it to will make antibodies. That doesn't prove you need it. You need to prove that it does something. If you give them 3 vaccines, will they transmit the disease less? No evidence of it. Will they be hospitalized less? No evidence of it. Will they die less often? No evidence. There is no evidence other than the laboratory tests saying they make antibodies, but no evidence that they need to make more antibodies. But one thing we know, if you're a young person and have had COVID recently, even the CDC admits this. If you have had COVID within 3 months and you take a vaccine, you have a profound risk of getting an overly exuberant immune response and having the myocarditis because you've had the vaccine in the middle of an immune response that you're making against the disease. And yet, do you recall anyone at one of these pharmacies that are all handing out the vaccine and pushing it? Have you had any example of them saying, well, have you had COVID recently? Maybe you should wait 3 months. No, nobody's paying any attention to natural immunity. Nobody's paying any attention to the natural course of this disease. And nobody's really paying any attention to the danger the vaccine presents to young people. This is not a benign situation. This is a situation where the Democrats are in favor of mandating a vaccine that puts their health at risk. We are telling kids all across America, you cannot come up here unless you get what the Democrats tell you is the best thing for your health. And even though there are some scientists who say that it actually may imperil your health, you don't get a choice, and you can't be part of the nationwide Senate program. You can't be part of this elite group unless you submit, unless you bend the knee to the Democrats, unless you say, my body belongs to the Democrat Party. My body will be injected with whatever the Democrats tell me I need to do because I don't have control over my medical decisions. The Democrat Party does. This is obscene, And the Democrat majority should be embarrassed that they are here today telling us that American parents and American families are not smart enough to make their own decisions. In the letter, Dr. Prasad and his colleagues wrote that the underlying health plays a substantial role in COVID-related mortality. And inclusion of mortality not related to COVID-19 in observational studies would provide important context. So in other words, it looks like the studies that may have shown any indication that boosters might help were incorrectly performed. But the vast majority of the studies have shown no effect on transmission, hospitalization, or death. They do not exist, and I would love for the Democrats, when they stand up and talk about forcing kids to do this, if they would present the studies for us that show why, or show that the booster vaccine actually aids in reduction of transmission, hospitalization, or death of adolescents. Even from within the government, though, some have resisted the ever-expanding booster mandates. In 2021, the director and deputy director of the FDA's Office of Vaccine Research and Review, not someone who's opposed to vaccines, someone who's been involved with the development and promotion of vaccines his entire career, resigned. Two of these guys resigned, citing White House pressure to approve third doses for all adults, writing damning op-eds critical of the FDA's subsequent decision to do so. One of these op-eds ran in the Washington Post and was co-authored by Dr. Paul Offit. Once again, not an opponent of vaccines, not an opponent of the COVID vaccine, a professor of pediatrics and a director of Vaccine Education Center at Children's Hospital of Philadelphia, a longtime advocate of vaccines who's been involved in the mainstream pro-vaccine community, objected. As a member of the FDA's Vaccine Advisory Committee, Dr. Offit did not support widespread boosting. He and two former FDA officials wrote that healthy young persons with 2 mRNA vaccine doses is extremely unlikely to be hospitalized with COVID. So the case for risking any side effects, such as myocarditis, diminishes substantially. Dr. Offit even advised his own son not to get a booster because he was already well protected against severe disease. So here we have advocates of the vaccine, mainstream scientists who work in the vaccine community, who've been promoting vaccines for the health of the community. These are not people opposed to vaccines saying they would not give a booster to their child. They would not give a third COVID vaccine because the risks of the vaccine outweigh the risks of the disease. This really encapsulates the debate here. Your health care is about you. You're not a statistic. The Democrats somehow feel you are a cog in their wheel, and you're just supposed to do what everybody does and do as you say. But really, your health care decisions are based on your risks of getting COVID, your risks of dying, being hospitalized, or transmitting it. It's about you. That's why you make the decision. Instead, they want a blanket mandate. And by doing it to the pages here and forcing them to submit to this, what they are doing is setting a terrible example for the country. One editorial put it this way last year: if being boosted becomes a prerequisite for participation in normal life, the vaccine's diminishing efficacy means the booster campaign will never end. What does that mean? The virus is evolving. It's like the flu. It's changing every 3 or 4 months. The vaccine becomes outdated within 3 or 4 months. So if you're at risk, by all means, keep getting the updated vaccine. We're not even mandating the updated vaccine. We're mandating a booster, and often a booster that's a year or 2 old and has no effect at all on the vaccine, even for people who are susceptible to this. But we need to let the individual, kids and their parents, make this decision. Dr. Marty McCary is a professor at Johns Hopkins School of Medicine. He wrote in the Wall Street Journal that the U.S. government is pushing COVID-19 vaccine boosters for 16 and 17-year-olds without supporting clinical data. A large Israeli population study published in the New England Journal of Medicine found that the risk of COVID death in people under 30 with 2 vaccine shots was 0. So there is no science behind this. A large study of the entire country of Israel, which keeps great records on this, found that kids that had been vaccinated twice had 0 deaths. Germany showed the same thing. Not just a few, not a small number, 0 deaths among kids age 5 to 17. There is no scientific rationale for mandating 3 COVID vaccines for healthy kids. Even the World Health Organization chief scientist, Dr. Suma Swaminathan, said last year that there's no evidence right now that suggests healthy children and adolescents need booster shots. Even the WHO, one of the most pro-vaccine mandate groups you can find in the world, has said they don't recommend booster shots. Dr. Martin Kulldorff of Harvard Medical School says that mandating people who have already had COVID still get vaccinated makes 0 sense. 0 sense from a scientific point of view, and it makes 0 sense from a public health point of view. A study in The Lancet supported this view, stating that the current evidence does not appear to show a need for boosting in the general population, in which efficacy against severe disease remains high. What does that mean? Why do they have efficacy? Why can they fight it? Because they're young and healthy, and the disease seems to have a predilection for the elderly. They're young and healthy, but they've already had COVID. They have immunity, and many of them have all been vaccinated. But we aren't demanding even just basic vaccination. We're demanding 3 vaccines. And what we know is that with each individual vaccine, their risk for a heart inflammation goes up. It's less if they have 1. It's less if they have 2. It's even more, though, if you get to a 3rd. When we consider the rules for the pages, we ought to ask, will these policies be expected to continue indefinitely? COVID's with us forever. COVID is now the new flu. Fortunately, it's become less deadly over time. It was quite deadly in 2020, and each successive evolution of the virus has made it less deadly. The death rate is dramatically reduced. Even at its peak, the death rate was about 0.3%, about 3 times greater than the seasonal flu. Still meant 1 million Americans died either from COVID or with COVID, but it's now lessened in severity. Are they going to continue to tell us how to make our health care decisions forever? Are Democrats so insistent that they know better than everyone else that we will be beholden to bending the knee and asking their permission to live? Are we going to ask permission whether or not they will come to us and say, to participate in life, you have to be vaccinated 3 times? There is no science to back this up. When it comes to vaccines, although they can benefit the vaccinated person if that person is in a risk category, in Denmark, vaccines were not shown to have any impact on household viral transmission or secondary attack rate. Even the proponents of the mandates will admit, if forced to admit, the vaccines don't stop transmission. The only thing they can hang their hat on is there's reduced hospitalization, but that only exists if you're in a category of increased risk. Over a certain age, over a certain weight, have some diseases, immunocompromised. There is some evidence of reduced hospitalization if you have immunity. But actually it's less so with each subsequent one, and really hasn't fully accounted for the natural immunity that people get from having the disease, which still needs to be studied. Multiple scientific studies have shown, though, that there's a heightened risk of myocarditis, heart inflammation, for children and teenagers after taking mRNA COVID vaccine. That's why multiple countries began restricting it for certain age groups. Germany, France, Denmark, Finland, and Sweden all restricted Moderna's vaccine for young people. Norway, South America, and the UK all chose to recommend only 1 dose of Pfizer due to the risk of cardiovascular side effects for booster in kids. But what we're going to find out today is the Democrat Party doesn't care about the science, doesn't care about choice with regard to your medical decisions, can't even allow a debate whether you get 1, 2, or 3 vaccines, but is going to insist to be part of the U.S. Capitol, the U.S. Senate's PAGE program. You must bend the knee to the Democrat Party and do what they say about your vaccines, or you can't be a participant. Why is the U.S. Senate choosing to ignore risks other countries acknowledge when mandating these vaccines for young people who are in peak physical condition? Public health measures should be backed up with proof. that the benefits outweigh the burdens. There is no evidence of that when it comes to vaccination and booster mandates, especially for teenagers, who as a group are less vulnerable to this virus than any senator. That is why I ask unanimous consent that the Senate pass my resolution to end all COVID-related mandates for pages who serve in this chamber. As if in legislative session, I ask unanimous consent that the Senate proceed to Senate Resolution 332, which is at the desk. Further, that the resolution be agreed to, the preamble be agreed to, and that the motions to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President.
The Senator from Maryland.
Reserving the right to object. Mr. President, I have major concerns about this unanimous consent request. But let me start first with the process, whether we should be legislating a policy in regards to the health of our pages. Despite what the senator from Kentucky has said, the policies concerning our pages' health is not set on a partisan basis. It's set based upon the recommendations of our health professionals. They're not politicians. They're not making partisan decisions. They're making their recommendations based upon what they believe is in the best interest of the health of the people that work in this institution, including our Senate pages. So I'm concerned about the unanimous consent request because it would legislate areas that should be left to the administration based upon the recommendations of our health professionals. But secondly, as I look at the legislation that the unanimous consent would adopt, it goes well beyond COVID-19 vaccines. It goes to wearing a mask, having a legislative prohibition about requiring a page to wear a mask. That's pretty broad. We don't know what's coming. We don't know what our requirements are going to be and needs to deal with public health in this institution. And again, that should be left to the health professionals. We shouldn't be micromanaging what the health professionals tell us is in the best interest of the people that work in this institution. Let me just point out that COVID-19 cases are rising all over. We know that. And we don't know what's going to be the best countermeasures in order to deal with that. But we do know that vaccination, testing, and maskings are effective countermeasures to reduce the spread of COVID-19 and other respiratory diseases. I recognize that Senator Paul has put into his comments studies that he's quoted. The overwhelming evidence that has been presented by the health professionals globally, including here in the United States, is that vaccinations, testing, and masking are effective. And Mr. President, I would ask unanimous consent, and I can put into the record the listing of those types of studies that would counter what Senator Paul has said.
Without objection.
Schools throughout the nation implement public health requirements to keep students, teachers, and their communities safe. Let me remind my colleagues, the pages are in a page school. They should be treated no differently as far as the protection of their health than other students around the nation and those responsible for their safekeeping. We need to follow science. We need to follow what science tells us we should do. We shouldn't respond to the political whim or the political pressures. We should let science make the judgments that keep our people safe, particularly our Senate pages. There is no credible evidence that supports a prohibition on requiring COVID-19 vaccinations, testing, or masking. In contrast to overwhelming evidence indicates that it is important tools in helping dealing with these issues. I'll mention one other issue just in passing because I know we're going to get to a debate on the floor soon about the spending programs for our country and how we're dealing with the costs. Well, there's a lot of health care costs that we would like to get contained. And every time we don't deal with the spread of an illness or a disease, it adds to the costs to the taxpayers of this country. The Senate has a duty of care with respect to the pages. Their well-being is our responsibility. And for those reasons, Mr. President, I do object.
Objection is heard.
Mr. President,
Senator from Kentucky.
the argument has been made that we should leave these decisions up to a doctor. Well, the thing is in America, we don't appoint like a doctor as dictator. We don't appoint one doctor. You get a choice. You get to choose your doctor. If you don't like your doctor's advice, or you think your doctor's advice is invalid, such as it is in this case, you go to another doctor. In a free country, the decisions are made by individuals, and each individual will assess their risk. Now, the argument has been made that there is overwhelming evidence on the record. That's just frankly untrue. There is no evidence, and I don't say that lightly, zero. There are zero studies in any of the scientific literature that show that a booster for adolescents reduces transmission, hospitalization, or death. Zero. They only approved the booster to allow you to make the choice of using it by saying that you make antibodies. Making antibodies proves that vaccines work, which no one disputes. Vaccines work to induce the production of antibodies. But the question is, if you've already had COVID, do you need 3 vaccines if you're a 15-year-old kid? The answer of all the literature is you don't need that vaccine. So what we've found today, he says, oh, this isn't partisan. Well, it certainly is partisan. Do you see any Republicans over here objecting? The Republicans unanimously support getting rid of this mandate. The Democrats are objecting because the Democrats don't think that individual Americans are smart enough to make their own decisions. The Democrats don't think that these kids and their parents and their doctors can make their decisions. They don't believe in choice when it comes to medical decision making. They believe that they know better. But in this case, it isn't just a matter of taking something that's ineffective. It's mandating a vaccine that threatens the health and well-being of these kids. Not just a vaccine, mandating 3 vaccines. No mention of even whether the kids have already had COVID, which is essentially another inoculation. So this is a disappointing day, but this is consistent what we've seen time and again. Whether it's having a nationwide emergency, mandating that you wear masks in school, masks on planes, vaccines here, vaccines there. This is a desire by the majority party to control your life, to control your medical decision-making because they know better. They want to beg off and say this is about the science. I recited 15 different studies for them. They didn't recite one study because no study exists saying that 3 vaccines for kids reduces hospitalization, transmission, or death. There is no science. Large nationwide studies of this problem have gotten a dozen countries to say we shouldn't be giving 3 vaccines to kids. Half of Europe won't allow you to do it. They won't allow the mandates. The argument is made, oh, well, we have to do what everybody's doing in the schools. Even the colleges, 90% of the colleges aren't requiring this. This was a bad mandate from the beginning. Most of the colleges have woken up and understand now, 1, that this is America and you ought to be able to make your own medical decisions, but 2, that the science points towards booster vaccine mandates actually being a threat to the health and well-being of adolescents. So I'm very disappointed, but I think this illustrates where we are in America, where one party thinks they're smarter than every American, smarter than every individual, and they will make your medical decisions for you. I rest my case.